As the St. Catharines Hospital's Chief of Medicine, Dr. Lorraine Jensen has been on the front lines of the pandemic since the beginning, right in the thick of things on the COVID unit. Dr. Jensen, welcome to The Source. We begin our program with you today. You have been involved in this right from the start. How has that impacted your career, your life?
Well, I think it's safe to say that COVID has affected everyone's life and many people's careers, but mine certainly did change when the pandemic hit just over a year ago and we had our first COVID patient. I am based at the St. Catharines Hospital, as you mentioned, and I'm a general internist. And so we take care of the vast majority of admitted patients to the hospital. And we were the ones that really cared for the vast majority of COVID patients throughout all of the waves. And unfortunately, as everyone knows, we're in our third wave now. And, I think initially when the COVID pandemic hit, there was a lot of uncertainty, and there sometimes is uncertainty in medicine, but certainly not that much. So I think that was very stressful. It was stressful that I didn't know whether I was going to get sick and bring that home to my family. So that's something that I think I've had a little bit more comfort with going forward. And then my world at work kind of exploded. There were a lot more need for leadership roles. We've now worked with not just within Niagara Health, but hospitals across the HNHBB LIN, which has been really nice to see. I think COVID has brought the community together in unprecedented ways. But there was certainly a lot more work to do, and a lot of it was quite unsettling.
When you say more leadership was necessary, you're meaning basically that consulting with other doctors in other systems was part of what you had to do to get to the root of things.
Absolutely. And we really leaned on our infectious disease specialist locally, Dr. Kareem Ali, but there was a lot of communication. And like I said before, I think there was a lot of collaboration within the medical community, and that was a good thing. We were all learning on the fly when COVID first hit. And I think not reaching out and collaborating with other people would have been a mistake, just because there was so much information that was becoming available really daily. And during some days, it felt hourly that there were new breakthroughs and new information published. There were also leadership roles within the region, the HNHBB region. So we formed a committee that was specifically talking about COVID and how we as a region were going to manage the ebbs and flows of the pandemic, knowing that it probably was not going to be a short-term thing. And so I sit on that working group with physicians from Hamilton hospitals. And so there was a lot of work to do, and a lot of people, not just myself, really stepped up and took some leadership in the pandemic. And that has really resulted in successful care for patients in Niagara.
We go back to those early days, the impact of this on your family. What was that like?
So the impact on my family was challenging. So I have two children, my son Colton and my daughter Kaylee. Kaylee is in daycare, so I don't think she'll remember a lot of this, but my son is now in grade 1, and he is very aware of what's been going on. And I think the effect of the pandemic on children cannot be overstated. And I think we still don't know a lot of what they have been experiencing and what the long-term effects may be. And so that's really been challenging, watching him try to adapt to online learning and going back to school. And he was also quite worried about whether mom would get sick at work, because that really was a question. There were outbreaks in our facilities. And so that was something that he was astutely aware of. And so I think it really had the biggest impact on him. It also had a big impact on me. I'm very close to my family. I haven't been able to, see my parents the way that I would want to see them, or my brother or my sister. And that's not unique to me. That's unique. That's something that everybody in Niagara, everybody in Ontario, Canada, the world has had to deal with. But I think those are very challenging situations. We are social creatures, and we really depend on that, that social contact. And we just haven't been able to experience that during the pandemic.
Besides your role as Chief of Medicine at the St. Catharines Hospital, you're also an assistant clinical professor at McMaster's DeGroote School of Medicine. How has this impacted young people who are new to the profession, maybe doing their first residencies?
So that's also been very challenging. And I really feel for the medical students and residents that have trained during this time. When I look back at my training, those were some of the hardest years of my life. Just all the information that you're learning, the stressors of matching to a residency program, and then to be essentially taken out of the hospital and put onto virtual learning. That's not how medicine was intended to be learned. And so I think that was very stressful. And then for those learners to then have to turn around and come back to the hospital, most of what I heard were positive feelings about that. They wanted to get back and seeing real patients. But again, there was kind of this uncertainty of, Am I going to get sick? Where is COVID in the hospital? We did protect them somewhat, so they did not see COVID patients at the beginning, but they are actually seeing COVID patients or patients who are suspected of having COVID now. And so they're right there on the front lines with us. But I definitely don't envy them. And, I feel for them. It's a tough time to be learning medicine and practicing medicine.
When we look at the numbers increasing right now, do you anticipate that very soon we'll see a heavy stress on the hospital system?
Unfortunately, I do. We're already seeing it. So we are already well into a third wave, and some of our hospitals in the region have been experiencing very high COVID numbers. And it seems anecdotally like there are more ICU admissions happening and in younger people. And so that's very, very worrisome. And the other thing that I worry about is the frontline caregivers, the frontline healthcare workers. They've been at this for over a year now. And so, at the beginning, there was a lot of camaraderie, a lot of optimism, and now people are tired. They're very tired. And I mean, the members of the general population are tired too. And so I do worry about what the effects are going to be of this third wave on frontline healthcare workers.
It sure is wearing out its welcome. Dr. Jensen, thank you so much for giving of your time today.